Sorry, we're running a little late, a little technical difficulty. Nicole's still adjusting the camera. There she is. So she's the one that's actually behind the scenes, helping me out each week. And we had a great week of people watching, which we're really, now that things are getting back to normal, people are getting to school or whatever hybrid model they're doing at school. Hopefully they have more time and resources to come watch what we're doing and being silly on this Facebook Live and Instagram and all that. So, last week we actually okay. So there's that again was Nicole. So basically, last week was one of our best weeks as far as people watching, questions. So it's putting more pressure on me to continue to put out information that's actually good and means something. So we're getting more questions about low back pain, social issues. We're going to talk about stress this week. We're getting a lot of different types of stress. I kind of alluded to it last week. I've also talked about my daughter a lot. She's doing great in Colorado. They made national news. Basically, they went from 100 degrees to 30 degrees overnight, and it was snowing yesterday. So I thought it was adorable because, I push exercise and everything out. So I'm not just someone who just talks about, we actually prove it. And I was so proud of my daughter and her roommate yesterday because they hiked the mountain in the snow and just loved it. So, don't let anything deter you. We're excited because in Michigan, they're raising the gyms and the workout facilities to be open again. So everybody's really excited. Everybody's going to get back in there. And really, I kind of want to talk about that to begin with, is don't just jump back to your routine. For all of us getting back into the gym, this wasn't a question, but definitely an issue. Same thing I talked about with work. You can't go from 0 to 100 miles an hour right away. You're going to hurt yourself. So getting back into the gym, great. You may not be able to do your routine. I would highly suggest you do your routine at about a 75% start. And that's a good basis. And if it's like, hey, I'm fine, I've been keeping in shape, or for those people like, I haven't done anything. I've talked to so many people, Dr. Pierce, I haven't done anything since this thing has started. I don't have my gym, I don't have the resources, and now the gyms are opening back up. Again, you can't go from 0 to 100, you're going to injure yourself. And a lot of the injuries happen in the shoulders, the knees, the hips. And again, I'm always concerned about your back and your neck. So it's huge to be absolutely promoting. You need to start working out. Again, use that 75% as your starting point. If you feel like it's still too much, you back down. But 75% is about where you should go. So if you're doing an elliptical, or you're doing track or bicycling, stationary bikes, anything like that, try to back it down. If you were doing a half an hour, start with maybe 20 minutes. And if you feel good, come off, do a little bit of a stretch, and then go back and do another 10 to 20 minutes, which is better. As far as weightlifting, that's a little bit simpler. If you're doing curls with 10 pounds, then maybe do it with 5 pounds or 7.5 pounds for the easy math. But you understand what I'm saying. Because you are at risk. If you go, again, 0 to 100, right back into your workout, you're gonna be at risk of injury, especially if you're a little bit older. I mean, to be honest, it's my problem. I hurt my left shoulder because I try to go back from 0 to 100, and unfortunately, my routine has been off since COVID. It could be surprising to some, but I usually work out 2 to 3 times a week. I had my routine, and my shoulders have actually gotten weaker because I've lost my whole routine for my upper body and my shoulders. I ended up doing a little bit more in my shoulders and injuring my left shoulder last week. So, again, cautious. If you have further questions, let us know. But getting to the program, question 1 basically says, my low back pain, I have low back pain. Are there any triggers I should avoid? So again, tying into what I was just talking about, you have to be conscious of what's going on. Is there triggers? The most obvious trigger is excessive bending and twisting. So that's the worst number 1 thing to do. So what I always say with my injured patients or people that are having problems with their spine, you do it in simple planes, meaning, excuse me, meaning that everything is lined up in front of you. If you're working at a workstation, you don't want your computer over here where you're twisting over here, and then you're using your phone over here. You want everything lined up. So the monitor is lined up, the phone's lined up. You don't want to be off to the side holding the phone. There's headsets now for the neck, which is huge. You don't want to be doing a lot of side bending. If in your back, when you're doing lifting or any type of assembly work, or work in where you currently are, like dentistry and things like that, you want to work in simple planes, meaning put the thing in front of you. So it's not like you rotate over here, you're going to move your whole body over to where that object is or whatever you're doing. So you want to line yourself up so you're parallel with what you're looking at, kind of like the way I am in the screen right now. So you want to move your feet. Moving your feet just 2 steps actually reduces the amount of discomfort. So if you're in that rotational movement, where you're staying in that position for 20 to 30 seconds, you're irritating the nerve. That's a rotational movement on the nerves and the facet joints, which is very concerning overall. So again, the biggest trigger, which is the easy one, is excessive bending and twisting. And extension, when you're kind of leaning back or you're working or reaching for something, move your whole body, sit in a swivel chair, get up. You need to stay in those parallel movements. So that's pretty much the big ones. As far as others, we don't want you moving couches. I tell people, don't be the person who's going to help. You want to use good mechanics, always the mechanics. So you want to use the power of your legs. You don't want to bend at your waist and lift from there. You want to, move the object, whatever it is. If it's low back pain, you want to move it a little bit away from the body, bend with your knees, stay in that parallel position, and lift all together with your arms and legs at once. So those are the simple ones, but that's not life. Like, I deal with mechanics. I know these guys that are big, heavy equipment mechanics. They're underneath cars. They're leaning over into the hood of the car, and they can't do that. They tell me I'm crazy. You come watch what I do all day. And it's true. You have to be cautious. At that time, sometimes we'll put a belt on them, a cautious belt, to keep in caution. So it's a reminder. It's not necessarily a whole protective brace to support it, because if you wear a supportive brace, you're eventually going to weaken the muscles. But when you're doing a very intense movement, it's time to cinch it down, what we call, it's a Velcro with double Velcro, a double system, where you do both systems to kind of tighten up and brace your back for support. So triggers, again, if you're working out, you've got to be careful on how you're working out. Mechanically, I always, everybody tells me they have a trainer. You have to have a trainer that understands mechanics and injuries. Trainers are great if there's no mechanical injuries, but when there's injuries, you got to make sure they know what they're talking about, because they notoriously create more of an issue. So be careful. All trainers aren't created equal. We haven't said that in a while. So question 2 comes from a friend of mine in California who's having his own issues these days, but he says, Doc, I've been working from home ever since the virus broke. I'm getting stir crazy for one, but I've also seemed to be busier than ever, and my back seems to be more sensitive, perhaps because I'm sitting more. Are there any quick exercises, drills that you can recommend to help me physically and mentally? So this is my buddy trying to dig at me and get me to say stuff, but it's a true comment that's been throughout. I've had so many patients say, look, usually at work, I'm getting up, I'm moving to, have a conversation, or we have a conference, or we have a meeting at this point, we get up to get water, we do stuff. While I'm at home, there's no meetings, there's no conferences, it's on the phone, it's on the computer. So they find that they're sitting 8 to 10 hours at once, which I totally discourage. You cannot do anything. The rule is 20 minutes. Can you get up to 60 if you're healthy? Yeah. Any patient of mine that's being treated for back pain or neck pain shouldn't be doing anything consistently for more than 20 minutes. That doesn't mean at 20 minutes you get down on the ground, you lay, you do all your exercises. It means you kind of stand up, you get your back up, you arch your back, you reach your arms up above your head. You just kind of do a little bit of sweating. You have to break what we call that cycle, that muscle firing cycle. So what happens if you stay in that same position, we have this thing called gravity. And gravity is working against you all day long to keep us upright. So you're firing your muscles to keep you upright, so you're actually over-firing. So if you're trying to hold a position, like if you're on a Zoom conference and you're holding a position, you want to find yourself perfectly aligned in the screen, you're going to create an overfiring, which will cause that spasm, that muscle spasm, which causes a problem, a cascade of problems. So what you do is, if I just have that little timer or clicker, which I tell people to do for at least 20 minutes, and you just kind of lift your chest up, lift your arms up, whatever you need to do, what you've done is you've reset that whole program. You can go back to that position like I just did, and then that resets it so it doesn't cause that firing. So what happens from a physiological standpoint, from what the body's trying to do, the muscles and the structures of your body are holding it in position. So to hold it in position takes a lot of work, and it eventually will create an overfiring or an overuse problem, and you're having an issue. But if you reset it, it kind of resets the whole program, so you can kind of start over. So when I say 20 minutes, it's not get up and lay down, do your 30-minute stretches. It's just, break it for 2 minutes, shift, move. You're going to realize you can do a lot more throughout the day and you won't feel as bad at the end of the day if you do things like that throughout the day. So to get some exercises in physical and mental, I've pushed yoga huge. And for him also in California, more than ever, he probably needs a little mental release. We talk about undue stress and things else going on. Everybody's having different areas of stress. It's not directly related. It's, it could be one or two different things or pressures, undue pressures that you're putting on yourself. You're trying to perform. I just heard today that there's going to be a fallout in 6 months. People are starting to worry about that from a financial standpoint. So you have to find your zen, if you want to call it the zen. You just have to find the area where you can chill and relax and go to your happy place. Everybody should have their happy moment. Like I always say, take a deep breath and go to the beach. Whatever you need to do. I don't encourage alcohol or anything like that, but whatever you need to do to kind of relax, because if you realize if you don't take a deep breath, everything is very tight, and that creates increased pain. And again, that firing pattern, that muscle spasm, those things are a problem. So you need to have, yoga is really good on meditation and relaxation and breathing. Breathing is probably the most understated importance that we need to focus on. For you to breathe and relax, and it's truly relax all the muscles. When I was pushing yoga in the beginning of when we started Facebook, that was one of the biggest things we said. We need to meditate, you need to take a deep breath and let it all out. Exhale, let your body just relax. So again, physically and mentally, core work is always huge. Core, again, for the low back is your abdominal muscles, and that's from your belly button down to your pubic bone where your privates are. That's the most important part. So if you do that for your abs and what we call the paraspinal muscles, the muscles on either side of your spine, again, from your belly button going through your back and down to your pubic bone, are the most important muscles. The second are the oblique muscles, the rotational muscles. Then there's your glutes. So those are the 4 big muscle groups. And then we can start talking about core muscles around every other joint, which are important also. But in this case, he's talking more about his back. You have to do the core. And the thing is, everybody hates doing them because they're harder to do because you've neglected them, especially if you have a low back issue. So moving on. So question 3 comes from Maria. My doctor is Dr. Bono. I have an appointment with him, but I got into a car accident and my MRI reads that I have bulging discs in between my 2 shoulder blades. I was wondering if I need some kind of surgery because it keeps popping a lot. So we talked about this last week about the thoracic spine. Basically, that's probably why this follow-up question happened. But the rib cage acts as a natural brace around the thoracic spine. So the thoracic spine, again, is from your neck down to the above. If we go back to your hips, if you go to the top of your hips and come across, draw a line over to the middle of the spine, that's your 4th level of the lumbar. If you go up 4 segments, you're going to be at the lower level of the thoracic. So majority of the thoracic spine is protected by the rib cage, and the rib cage acts as a natural brace. So we don't see a lot of surgery in those areas because of that, because it is protected. It's not like your neck where it's out hanging and it's at more at risk of whiplash injuries and stuff like that. And your low back also is the weakest part of your body naturally. So the thoracic spine is rare. So if you're having 2 discs there, a lot of times they become asymptomatic. If they are symptomatic, like our patient last week was having wraparound pain, that's a red flag. If you're just having mechanical pain between your shoulder blades, a lot of times that's adjusted with medications and therapy and home exercise program. So a lot of times we do not need to do surgery on the mid-back, and probably Dr. Bono would agree with that. So I don't remember why you're seeing Dr. Bono, but the thoracic spine, we should probably see if we can resolve it just with therapy and medication. So, moving on, do you think back pain can be cured or managed? So, the number one risk factor, the simplest thing to put this is the number one risk factor for back pain is a previous injury. So anyone who has back pain, you have the number one risk factor for a second episode. So with the second episode, what we try to do is make you aware of it. We're educating you. We work on prevention. So when I first started my practice, we talked about prevention. I think I mentioned this before. Is it prevention or we prevent other issues going on? And it's a prevention that we're trying to educate you on what you can and can't do, what you should and shouldn't be doing. So what I call the do's and don'ts. So I'm not doing my job. In Michigan Sports and Spine, we're not like, here's your back pain, here's a pill, you'll be fine. There's no way we would do that. We're here to evaluate you to a very detailed level. We don't just sit there and put on your diagnosis low back pain. We try to figure out what's involved. Is it mechanical back pain? Is it nerve related? Is it disc related? Is it shifting? Is it necessarily other pathology, meaning potential tumors? Is it a referred pain? So there's a whole laundry list of stuff. Granted, majority of it turns into mechanical back pain that we are able to treat with nerve irritation, which is what I would say at least 50 to 70% of our diagnoses are. That doesn't mean we're going to miss out on the other 30. Going to a doctor that's not as well versed in treating spine, you're going to run into that where they're going to just go after the 50% that I'll get better either way. That's not us. We're the ones that those all fail from. We get the ones that fail all the easy stuff. So we definitely take it to a level that we need to understand what's going on. So we take a very detailed history. We want to know the mechanism. We worry a lot if low back pain comes out of nowhere. If there's not a mechanism of injury, that's actually a red flag for us why this is happening. So there's things in our history and questions that sometimes people are like, why are you asking me that? It's all leading to the puzzle that we try to figure out. So again, if you have back pain that has no issues or injuries or wear and tear factors, it's actually much more concerning. We ask a lot more questions, especially with the medical history. There's a lot of referred pains from the body, that are not always good. We talk about tumors, we talk about aneurysms, we talk about bleeding disorders. We talk for females, we talk about female issues, that ovarian cysts, hysterectomies, problems with their uterus. So all these things play a major role in what's going on. We talk about urinary tract infections. We've had plenty of people come in for back pain that have had urinary tract infections. So there's all those other details. You need to go to someone who's very confident in what they do for that. It's not just like, okay, can back pain, it's cured or it's managed. If we get it down to, our goal is when we initially visit you visit us actually, is that we get it to a point where we feel it's in our comfort zone. If we feel there's other issues, like if it is a bladder infection, if it is related to OB-GYN issues, if it's related to a prostate, things like that, we're going to get you to that specialist that you need to, or at least converse with your primary care doctor to make sure that we're going in the right direction. It doesn't mean to say that people with a urinary tract infection don't have back pain, but again, we need to prioritize because a lot of times those other things are more important than simple mechanical back pain. So to answer your question, can it be cured? We see people, I just had someone who hasn't seen us in probably 12 years. And again, I think these people just go off and see other doctors or something like that. There's a large percentage of people that we get better. And we change what better means. We don't get you where you're perfect, okay? You're not going to be 100%. I'm not going to turn the clock back and you're 25 and built and every muscle's bulging. It's where you understand and manage what you have going on. So our goal is we tout that we're over 80% success, and that means we're putting you back to a functional, pain-free lifestyle. That doesn't mean you're going to go jump out of a plane or play golf, 4 days in a row at 36 holes a day. I have patients that do that. They have their trip. I just had a guy 2 weeks ago, and he's like, I have my golf outing. It's my yearly thing. That's my goal. So we try to understand your goals and we get you through it. So probably manage is the better way of saying it. We definitely will manage through your back pain and make you aware of it. There's plenty of people that we get to where we say, look, you're going to do these core exercises, you're going to strengthen up, and they're way better. Like I have young athletes that blow their back out. I have a lot of young female athletes, and we make them better athletes because they start cross-training. And the cross-training is very important to have pain-free lifestyle following their injury. So the simple answer is it's more, I have to say manage, but we're trying to cure the issue so you're more pain-free in life. So overall, yes, we want to cure it, but more importantly, we're trying to manage it and educate you on what you should and shouldn't be doing. Again, getting back to the do's and don'ts. So question 5, what are the risks and side effects of PRP therapy? I've researched all the benefits. So that's why I like PRP. Again, we like to put it in. I want to talk about IV therapy too, because we're starting that also. But the PRP therapy is platelet-rich plasma. It's the healing properties from your blood. For those who haven't been listening or haven't heard, we draw your blood, we take all the healing properties out, we take the natural cascade of healing from the body and put it into the injured area. So what are any side effects? So what's great about it is when I was on the radio, we started calling it the whole foods of medicine. And what I really mean of that is that it's organic. It's coming from you. It's the natural thing from you. So for a rejection of that is very, very unlikely because you're taking it from your body, we're spinning it down, we're taking all the good healing properties of the platelet-rich plasma at anywhere from 10 to 12 times concentration and putting it back into that injured area. So the only other thing I can think of is if you use poor technique and get an infection from the needle, which is unlikely also with someone who's competent. There's very little side effects. There is, if it gets into the wrong area, you can create an infection into the area, something called a discitis. If you're putting it into the disc, there's a little bit more of an issue. Typically, if you're putting it into the muscles, the tendons, or the joints, it's highly unlikely. There's very little side effects. There's nothing we've seen, knock on wood. We haven't had any problems. The biggest thing is that there may be a delay or it's not healing as much as possible. But to be honest, on a personal level, on everyone we treated, I've been pleasantly surprised on the amount of recovery and help that it's had. We're promoting it more and more. It's out there. It's not foreign to people. People are coming to me to talk about it. We get more questions. And really, we're pushing it more because of the benefits. I just talked to somebody before I got on here that she's unable to do steroids, but we're trying to work with the insurance companies to understand that she can't take steroids and that the PRP is probably the better option for her in a long-term situation. But also we're doing PRP on a different level where we're doing it multiple times throughout the year. We're not doing it every other week, but ideally every 2.5 to 3 months we'd like to see to get that accumulative effect. And then stem cells, great. The other thing real quick is we're starting IV therapy. I feel that IV therapy, especially with everything going on, with COVID and everything, I understand what's going on. I'd love for people to say, build your immune system, treat your immune system. You need to enhance your immune system. My kids, if you ask them, and Paige is watching right now, my daughter, she's probably saying it out to herself right now, you need to eat more dirt. And it's funny, it's true, and it's meaningful. You need to build your immune system. If you stay in a sterile environment, your immune system doesn't have to work. It has to work when it's approached by other things, outside factors. So, for us medical people, we're supposedly exposed to so many other things, so our immune systems are working at a higher rate. I believe that's true. There's a lot of scientific papers. I'm not going to start quoting them. But in the big picture, I don't want you in a sterile environment. I don't want you cleansing everything. It's great to do it to be clean, but you have to be careful of the other side of it. That you need to work the immune system. So through IV therapies, there's great ways to boost that, enhance it. It's not going to replace, it's not going to solve, it's not going to guarantee you won't get COVID. But the thing is, you need to look at how nutritionally you're doing, how you're doing from an exercise standpoint, how how you're doing from a stress standpoint, how you're doing from a sleep-wake cycle. All those things are so important to create an immune system that works and helps you. So for those that are feeling a little bit off, IV therapy, I mean, it's big, it's been going on. I got more requests from our entertainers this past year than I have in the first 20 years of practicing this. We probably did more entertainers IV therapy because they feel run down, they feel at a loss, they can't catch up, and they get a huge boost. It's not just B12 anymore. We're putting multivitamins. There's different what we call cocktails. Dr. Abrahamson's, we're going to have multiple locations once we get this thing going. We would love your feedback to see if this is something you've looked into or if people are already doing it elsewhere, because we're doing it at sports medicine level. There's not too many people out there at a sports medicine level doing it. So I would, shy away from some of those. The individuals that are doing, like myself, that do it at the highest level for individuals, entertainers, athletes, weekend warriors, all that. It's not just IV therapy. I think got a bad rap out of Vegas because it was all about the hangovers. It's not. It helps with that too, but again, that's not what we're looking for. We're looking to boost your immune system, boost. We work with headaches. There's multiple things. So give us your feedback because we'd love to see. We have 7 cocktails that we're going to start with. But basically, if you're doing it or you have some more knowledge about it, I know I'm going to bring in my nutritionist, Lisa McDowell. I'm sure she's going to have some input into this, but we're looking to do it at a high level, not just, here's an IV and you're going to feel better because you're hydrated, because you were hungover. That's not our goal. But overall, in summary, IV therapy for sure. Again, Dr. Abrahamson's doing it. She's doing the peptide therapy. We're doing the stem cell PRP. Dr. Bonet's doing a great job. He's getting comfortable. He's starting to get his rhythm here. So he's taking on new patients. So tell all your friends if they're in question. We're doing telemedicine if it's hard for them to get here. We're still doing consults from around the country, not as much as we were. But it's fun. It's fun for us. It creates an excitement for us also. But overall, exercise is a great release for physical and mental release. If it's just that, if it's the yoga, if it's the meditation. Some people, they have to do kickboxing. Whatever your thing is, you got to do it. Get back in the routine. If you're just starting back because things are opening, again, start at that 75% mark. Again, Michigan Sports and Spine is all about the non-surgical approach. We're looking at every part of the body. We treat every part of the body. Again, with our new system and the new doctors, we pretty much cover everything from closed head injury to sprained ankles to spinal cord injuries. But our big thing is, we're pushing PRP and stem cell, and I'm over time on this time. We're not going to guarantee that you're going to be 100% better with your back pain, but again, because you have a number 1 risk factor, we're going to teach you as best we can what the do's and don'ts are and what you should and shouldn't be doing. And it's important, the last point, challenge me. Everything I say today, you can challenge me like they love to challenge some other politicians on what they say. If I'm saying something that you feel should be questioned or that you heard something different, feel free to contact us. Feel free to shoot us a question on things. And to be honest, that's what's happening. It's really exciting to see more and more people sending questions in. So it kind of guides me that maybe I'm not explaining well enough in certain areas. But overall, I love that people are watching. I love that my daughter is watching out in Colorado. Very proud of you. And everybody, judge people on their soul. Peace out.